Anything stupid in the frame? Just my face. Hi everyone, I'm Ian Harvey, massage therapist. This is my friend Summer.
Hi.
Today we're going to be talking about posterior knee pain. If you get an athlete in your office or just anyone who has knee pain, the first thing I'd like you to ask is, where do you feel that pain? Do you feel it more on the anterior portion, more on the posterior portion? Do you feel it on the inside, on the outside? Some people will report pain that feels like it's deep to the patella or like it's in the knee joint itself. These are all important clues. Today we'll talk about what it means if they say, it kind of feels like it's on the back of my knee. So let's get started. So my current client talks about having posterior and medial knee pain. And when I hear about that, I'm thinking hamstrings and I'm thinking gastrocnemius. Now, I'm thinking wrong, and we'll see why in a second, but for your client, if they're experiencing pain right around here, think about what hooks in there. We've got the hamstring muscles, which come around and insert down here on the leg, as opposed to up in the femoral region. So they insert right around here, forming a bit of a cuff with their tendons. The gastrocnemius muscle, it comes up, it passes this joint, and it hooks in right around here in the femur. So the hamstrings are crossing over, the gastrocnemius is crossing over, and they're forming kind of a mesh right here. So if one of these groups of muscles is overactive, or if it's getting an unusual kind of strain, maybe from the type of workout that they're doing, that can feel like knee pain. It can kind of feel like it's in the joint, because that's where this pain refers to. So if I'm working with a client who has posterior knee pain, I'm going to investigate hamstrings all the way up to the ischial tuberosity. I'm going to investigate gastrocnemius all the way down to the Achilles tendon. Now, when I'm working with the posterior leg and I'm thinking of myofascial release, I'm not thinking of any of these individual hamstring muscles. I'm thinking of forming kind of a steamroller and then allowing that to work. You'll notice that I'm leaning up against the table here, and the rest of my weight I'm giving to her leg. If I form a broad enough surface, I can give a significant amount of my weight to the client without causing any pain. And my angle of attack isn't straight down toward the table, it's up toward her ischial tuberosity. So this is what one of my opening moves is going to look like. And when you're doing myofascial release, think of origin to insertion and beyond. So work your way up to that ischial tuberosity and proceed past it. Go up onto the gluteal region a bit. Depending on your client's comfort level, you can continue with this all the way up onto the ilium. I'm going to be spreading in different directions. Again, we're thinking those broad sheets of fascia. And I might repeat that a couple of times. I also want to spread laterally, which I can do with spreading knuckles like this. I can do with my heels of hand like this if this doesn't bother your wrist. And I can do this with a nice duck grip. This is going to be drawing that fascia posteriorly. Something that the leg muscles seem to appreciate, especially as you get down to these tendinous portions down here near the knee joint itself, is drawing that fascia upwards and holding it. And as you hold this, I'd like you to monitor the consistency of this muscle and fascia and connective tissue between your fingers and thumbs, and wait for this to soften. And this can be either a static hold, or you can slowly come out posteriorly. If you'd like to look for trigger points, you can indeed work with individual hamstring muscles. And I don't dive directly into the tendinous insertion sites at the knee. I start with the belly of the muscle and the origin up at the ischial tuberosity. This is the same tactic I use when I'm working with a painful elbow. I don't work directly on the elbow at first. I work with the flexors and extensors. And I kind of dance my way toward that area of pain, possibly across multiple sessions. With the hamstrings, if you're relatively new to this, you're going to feel the hamstrings bump out from beneath your hand tools quite often, and you might be using too specific a tool, and that can be slightly uncomfortable, but that's going to happen. Those hamstring muscles are going to dodge out of the way, and as long as you're using a tool that has a bit of breadth, if it's broad enough, it's not going to be uncomfortable. It can actually feel kind of nice. Just remember, all roads lead to Rome. Always make your way up to this ischial tuberosity. So if you've warmed up this fascia, and you've done some specific work, maybe with fingertips, maybe with a single fist, maybe with a single heel of hand, you can look for trigger points, stay in close communication with your client, and if you find something that really jumps out at them, hang out there for a while and wait for that to soften under your fingertips, or for your client to report that they no longer feel the same intensity. If you're dealing with posterior knee pain, ask about anything that refers down here. And once you've warmed all this up, you've worked with some trigger points, you can start working with these tendinous insertions themselves. You may remember from massage school that this posterior knee is an endangerment site. And that's true. There's all sorts of nervous and vascular tissue that runs right through here, and it's very close to bone and cartilage, so you don't want to just press directly down in here. But if you go at an angle, you're not going to be compressing any neurovasculature. And if you stay away from this point directly on the back of the knee, like if you come out to the sides and work with these tendons, and if you work at this myofascial angle of about 45 degrees, you're not going to be causing any pain. You're not going to be impinging on any of the nerves or blood vessels that run back here. So this is my next move, is I'm going to use fingertips. I'm going to mold to my surface, and I'm still lounging against the table. I'm a very lazy massage therapist. And I'm slowly working my way up the outside and inside of that knee. This is another place where you can, using a duck grip, draw that fascia northward, so up toward the ceiling, and wait for that to soften. Now at this point, we're starting in on gastrocnemius. Gastrocs is this big two-headed muscle. You can feel its big gristly divide right here. It comes up and it latches in up here. So this does cross the knee joint. This can refer pain to the posterior knee. It can actually refer pain to other parts of the knee as well, including the knee joint. So a deep kind of pain. Whenever I hear about pain that's deep in the knee, I never ignore gastrocs. And I also, whenever I'm working gastrocs, I never ignore the fact that it comes all the way down, joins up with soleus in this Achilles tendon, and then joins into the heel. So I never ignore the heel. I never ignore this tendon or any of this tendinous region. And to start, I just do some nice steam rolling of this entire leg, this posterior leg. And Summer, do let me know if any of this is too much, okay?
Okay.
Thank you. So, I'm coming up on that endangerment site. I wish I could do air quotes right now, but I can't because I'm busy. So what am I going to do with my hands? Well, I'm going to dodge around to the sides a bit. So don't wail directly on that posterior knee, but also don't be afraid of it. Just come out to the sides a bit, keep your angle at that 45 degrees, and you should be able to do this in a pain-free way. You're going to be steamrolling over a lot of bony prominences, and that's just fine. That's going to keep you working with that fascia. And I'll repeat that at least once. Don't neglect the sides here. And in your more active clients, they might appreciate a bit of this sports massage type work. More vigorous. Really, anybody would like this kind of work. What am I talking about? All right. So, spread that fascia outward like this. Let your body weight do this work. And you can do this with carving knuckles. You can do this with open fists. I find that the way that's nicest to the calves is using my heels of hand. But if your wrists don't like this, then keep experimenting. And what I don't want you to do is to just get focused on the belly of the muscle, or the bellies of gastrocs up here, because there's plenty of good stuff down as we get closer and closer to this ankle. And I like to target the Achilles tendon directly. I'm still angled up toward the knee, but I'm not shying away from this tendinous tissue. Okay, and that's a good start. We've got our hamstring and our gastrocs nicely warmed up. Now let's get some movement into this. So when I'm doing anything with myofascial release, I like to work with different angles at these joints. So here we're going to be talking about the ankle joint and the knee joint. And using these different ankles gives the nervous system even more reasons to make changes. People often think of myofascial release as dealing directly with collagen or dealing directly with connective tissue. But a lot of what we do here is getting the nervous system to calm down a bit, to reduce tone in these hypertonic muscles, to reduce nociception in these hypersensitive muscles. And so if we use movement, that's talking to the peripheral nervous system in a way that it understands. Okay, so with the ankle plucked up like this, one of my favorite things to do is to just give it a good squeeze. So I'm moving my hands in opposite directions and allowing my palms and my fingers to basically throttle the ankle. I don't say that usually while I'm doing the massage, but I think it. So work with this Achilles tendon directly as you're working with this ankle. I'm kind of plucking it away from the ankle itself. I'm doing a bit of drawing up toward the heel. I'm drawing down toward the knee, and work with the heel. So this Achilles tendon becomes this fascia up here that cups the heel, which then becomes the plantar fascia. So if you're dealing with someone with plantar fasciitis, which I have a video on, which you can see if you click in the corner there, I always want to deal with all of this because this connective tissue is continuous with this connective tissue. So I'm kind of doing a pin and stretch here. I'm grabbing the muscle, which prevents it from going into its full extension, and then I'm creating some traction of that myofascia. And I could do a long flowing stroke here, kind of pumping this ankle as I do so. This can relieve a lot of tension in the posterior leg. And I would continue that all the way down to about here, to that posterior knee. Again, dodging around to either side so that I'm not pressing down directly on the posterior knee itself. Now, this hamstring region, this all becomes softer as I bring this knee into flexion. So it becomes a little bit harder to target individual muscles, but it's still easy to do these nice steamrolling moves. Just get far back from your working surface. And again, you can do a kind of moving pin and stretch. This also gives you good leverage to internally and externally rotate the hip. So if you suspect that the hamstrings are involved in your client's low back pain, deal with them from all sorts of angles. And again, the nervous system understands movement. So incorporate it when you can. I haven't been working with the IT band a lot here. That can definitely be involved in knee pain, especially lateral knee pain. I'm going to have another video on that one. Alright, this is how I would deal with posterior knee pain usually. but my particular client today has pain that is kind of hard to pinpoint, but this work that I do on the gastrocs doesn't really seem to fit the bill. It's not pinpointing where that pain is. It still feels a little far away. With a little further investigation, I found that if I go anterior to the gastrocs, right now I've got gastrocs scooped up on either side, what's directly beneath my fingers right now and directly anterior to my fingers is soleus. So soleus, where it comes up and attaches to the tibia, can be painful. So let's have a look at how I deal with that. Anterior to this gastrocnemius, I've got it pinched up in between my fingers and thumb right now. If I come in front of it and I press inward, I press toward the tibia, now I'm working with soleus. And as I come up more proximally, I'm going to start getting into the attachment side of soleus. And Summer, let me know when I'm right on that interesting area of pain, okay?
Okay.
Thank you. Take some easy, deep breaths.
Coming up on it.
Coming up on it? Okay. My client tells me that I slow down.
It's about right there.
Okay. All right. Continue breathing easily. Can you feel this anywhere else other than just under my fingertips?
A little bit lower and a little bit higher. It goes up and down.
Okay, so it's traveling some.
Mm-hmm.
So over the next 20-30 seconds, I'd like you to keep an eye on that referral and let me know if that broadcasting dies down, okay?
Okay. Yeah, it's going down.
Is it?
Mm-hmm.
Okay. And indeed, I can feel this softening under my fingertips. The first few times you work with someone's trigger points, it may take quite a bit longer than that, but after a few sessions, you might find that the muscle, that their nervous system starts to respond to you more quickly. It means that you can get through some of this trigger point stuff much more quickly. Since I've worked with this in the past and it's not as sensitive to touch as it has been in the past, I'm going to switch to a thumb and introduce a little movement. Sometimes if I move the tissue toward my thumb instead of just moving my thumb, it can feel different to the client. It can feel different to their peripheral nervous system. How about right there?
Feels okay.
Feels okay?
Mm-hmm.
Good. And there?
Feels okay.
Okay. So once you get to know where trigger points usually live, you'll be able to ask about specific points like that. Until then, just rely on your client and, of course, on good books like the Trigger Point Therapy Workbook by Claire Davies, which I quite like. All right, so posterior knee, think of the hamstrings, think of gastrocnemius, both muscles, both groups that cross this posterior knee joint. And don't forget about soleus. It might be responsible for some hard to pin down pain. That's about it for today. Leave me comments, consider subscribing, and I'll see you next time.